Today, we're going to be talking about sickle cell disease. What exactly is sickle cell disease? And how can we support people with sickle cell disease? Every June 19 is World Sickle Cell Day. This is a day we raise awareness for sickle cell disease, empathize with those living with it, and share how we can support them. Do you know that these people, they go through a lot of pain, a lot of missed activities. They do not have good quality of life. Unfortunately, there is no herbal cure for it. Please listen again. There is no herbal cure for sickle cell disease. Sickle cell disease occurs when your red blood cells, which is supposed to be round or spherical, has a crescent shape and has the sickle kind of shape. So what this means is that instead of the normal blood to flow through the arteries and the organs, well, these people, the shape of the red blood cells make it difficult to pass through the vascular system. And so, because of the shape of these red blood cells, these people have anemia, which is caused by premature dying of the red blood cells. Ideally, red blood cells last for about 120 days. But for them, no, it doesn't last that long. And so they are always short of red blood cells, which leads to anemia. And because their red blood cells are not normal, the oxygen carrying capacity of the red blood cells is not efficient enough. And so sometimes they have this painful crisis. Have you seen a sickle cell in crisis before? I bet you would not know when tears will roll down your eyes. The pain, the anguish, the helplessness. You wish you could help them to bear the pain, but no, you cannot. But do you know there's a way you can find out if your genotype has that sickle cell trait? Screening can never be overemphasized. Some people have this sickle cell trait, but they don't know because they've not been screened. They don't know their genotype. How many of you watching me now know your genotype? Do you know your genotype can help you in choosing a life partner? Because there are some genotypes that should not come together to marry because the risk of them giving birth to children with sickle cell is very high. What are some of the triggering factors in patients with sickle cell disease? Dehydration, extremes of weather, whether hot or cold. Even when there is stress, something as little as stress can put them into crisis. Infections can also affect them and lead them into crisis. And exhaustion. Some of them until they get to the hospital before they can get some relief. Sometimes they have to be rehydrated, given high dose pain relievers just to ease that pain. It is not just about the blood disorder, the number of school days they miss, the number of social activities they miss, the number of times they have to be indoors while their mates are outside playing. Let's raise more awareness on sickle cell disease. Sickle cell disease, it's not fun. I have seen firsthand the pain, the anguish of patients with sickle cell disease. Now I trust you to raise some awareness. Also, to tell your friend, to tell a friend, and tell a friend. Check your genotype. Do you have more questions for me? Would you like more clarification? Let's talk. Send me an email on healthtalkwithdrmo@gmail.com. Remember, the power lies in you. And to every sickle cell patient, you are a warrior. You are fighting hard. I see you. I feel you. You are strong. Keep it up. You are not alone. See you on the next episode.